Hi, I'm Susie Garden, and this is the Ageless and Awesome podcast. I'm an age-defying naturopath and clinical nutritionist, and I'm here to bust myths around women's health and aging so that you can be ageless and awesome in your 40s, 50s, and beyond. The Ageless and Awesome podcast is dedicated to helping women through perimenopause and menopause with great health, a positive mindset, and outrageous confidence. Hit subscribe or follow now, and let's get started. Hello, gorgeous one, and welcome to this week's episode of the Ageless and Awesome podcast. I'm really excited about today's episode. It's a topic that I don't think I've covered in the years that I've been doing this podcast. I don't think I've really covered it ever in any great depth, and that is the health of the vagina. So I'm super happy and excited to have a vagina expert here today in Alison Patchett. So Alison is the Vag Hormone Naturopath. She's dedicated to empowering her clients not only to manage symptoms, but also to identify and address the underlying cause of those symptoms. As you know, with naturopathy, we love getting into that underlying cause. She's all about empowering every woman to feel informed and confident about the health of their vagina and hormones, providing expert integrative support for women online or in person. She's based in Bundoora in Victoria. Alison addresses everything from hormone imbalances to intimate healthcare. Her approach is tailored to her clients' needs. She combines advanced testing, natural therapies, and lifestyle adjustments so you can reclaim your health and get back your sparkle. Alison, welcome to the Ageless and Awesome podcast.
Thank you, Susie. It's lovely to be here.
It's lovely to have you here as well. I guess I wanted to start off with a little bit about you and your journey and how you came to be interested in this area of specialty, and maybe a little bit even about the type of training that you've done.
Yeah, sure. So being a naturopath is a second career for me. So I worked in the corporate space for quite a long time and saw a lot of my colleagues get very burnt out and was very burnt out myself. And so ended up following, I think, what was a passion for a really long time in studying naturopathy. Once I started practicing, I found that the sort of people I was seeing a lot of hormones, a lot of women with menstrual issues, lots of PMS symptoms, those sorts of things. And I think it was sort of, I guess, when I was around 41 that I started to kind of look into my own health a little bit more and started to see more of those perimenopausal hormone clients come in, and then starting to see lots of vaginal issues, developed an interest in that, studied a 6-month course called Vagiversity, which was just amazing, which is a real deep dive into what's going on in the vagina and lots of different presentations and symptoms and all sorts of wonderful bits and pieces, and found that that was a real calling and a real passion to really help women in this, I think, really underserviced area of healthcare and underappreciated as well.
Yeah, absolutely. And this is something that I see a lot. I used to work in a local clinic here on the Gold Coast, and the intake form there was incredible with the amount of depth that went into with vaginal health questions. And I thought to myself, my gosh, when I first saw it, no GP has ever asked me any of those questions proactively. And it's really something that many women are quite hesitant to bring up. There is still quite a lot of stigma around the vagina. I mean, even just, and I'm sure you've had this probably on your social media, even writing the word vagina can be censored. Like I remember doing a story with the automated captions, and it actually, made a little, I don't know, an asterisk or something where the A was. It was just like, what? Why is this word being censored? It's just crazy. So no wonder women feel kind of hesitant to bring these sorts of symptoms to their healthcare providers' attention when there is still that level of embarrassment. Would you agree that is going on in this area?
Oh, totally. Yes, absolutely. I think there's a real reluctance from many women to kind of appreciate the extent to which some of their vaginal health issues are impacting their lives and their relationships and their self-confidence as well. And, some of my clients, will start on one area, and I do ask about vaginal health, and then, absolutely will be led by the client as to how comfortable they are talking about it. But absolutely. If we haven't touched on it before, certainly within the second or third consult, we are talking about vaginal health. It's something we're checking on regularly, no matter what age my client is, because it is such an important area of healthcare that is so often missed.
Absolutely. And there are a number of health issues that can present, I guess, in the vagina, particularly around that perimenopausal time. And that's a lot about what we're going to talk about today, which I'm really excited to get into. And I guess let's just start with the probably more well-known symptom of perimenopause and postmenopause, which is the dry vagina. So I guess I wanted to ask you firstly, what are the most common vaginal changes women experience during perimenopause?
Yeah, so dryness is probably the number one issue that people experience. And what goes along with that is often itching, irritation. That then leads to things like painful sex or even painful masturbation, which impacts on libido. We then have other comorbidities, I guess, or other symptoms that go along with that, things like prolapse or urinary tract infections, increased urinary frequency, which is not necessarily technically the vagina, but because of the location and the crosstalk that area, we can see a lot of crossover in symptoms and misunderstanding of symptoms because of the location, where pain might occur or where irritation or itching might occur. And so, as those estrogen levels are changing, that, really promotes those symptoms to occur.
Can you talk to me a little bit more about the misunderstanding of symptoms?
Yeah. So what I find with, and actually I had a client last week, we were talking about, they felt like they kept getting urinary tract infections, but they'd go to the doctor, they'd do a urine test. It was nothing there. There was nothing being cultured. And so what we did was we really talked quite specifically about the location of where this irritation was occurring. And I think we don't necessarily appreciate how close some of that anatomy is. And so therefore, what was being interpreted as urinary issues was actually further back. So it was actually the vagina that was painful and irritated, rather than the urethra where the urine was coming out of. And so it wasn't until we got into some really detailed questions and brought up diagrams and did all sorts of things to kind of really get into that nitty-gritty detail that we properly understood. And for this client, it was like, oh, of course. That makes so much sense now that they kind of understood a little bit more about what was going on. And that meant that we could actually move forward with an appropriate treatment plan rather than kind of her feeling like she had to keep, looking at potential antibiotics or other treatments that were just not going to be effective.
Yes, I know. That's something that I'm seeing a lot actually just with my own mother is the amount of antibiotics that she's being prescribed for recurrent urinary tract infections. And they're just not going any further in terms of, the underlying cause of that. And I think that is something that is a real problem, I think, in women's health, is that the amount of antibiotics that are getting thrown at these sorts of issues, rather than going, well, okay, come on, we know the underlying cause, which we're going to get into in a minute. What are we going to do about that? So let's talk about why this is happening. What is the underlying cause? Why are these changes happening?
Stay with us. We'll be right back.
How would you like to have increased energy, balanced hormones, glowing skin, and your ideal weight in just 3 months? Sounds awesome, right? Imagine having your very own hormone balancing and weight loss strategy totally personalized to you based on your body biochemistry to release excess weight, say goodbye to pesky perimenopause symptoms, and decrease inflammation in your body, which of course leads to decreased inflammaging. That's right, ladies, there are age-defying benefits as well. Oh, and of course, you have me at your fingertips for expert support so you never feel stuck or confused. I love supporting women on their weight loss journeys, and I've packaged up the award-winning Metabolic Balance Program with my signature hormone management system, giving you the GLOW protocol. This 12-week one-to-one coaching program is you and me, nailing down your health and weight loss goals, creating your personalized plan using your blood tests, a thorough health assessment, and your food preferences. And then we get started with me supporting you every step of the way. Even if you've tried everything, even if you have resistant weight and complex medical conditions, the power of personalized nutrition, mindset coaching, and my support is transformational and gets results. And I'm not even exaggerating, even if I do say myself. So if you're ready to embrace feeling like your younger self again, lose excess weight, manage health conditions, and regain your confidence, you can just DM me at Susie Garden Wellness or email me hello@susiegarden.com, and I'll pop a link in the show notes.
Yeah, so I guess estrogen is kind of the main culprit, good or bad. So as estrogen's awesome. Love estrogen. Estrogen and progesterone, they are so protective in so many ways for our body, and in ways we don't even fathom until we get to perimenopause and those levels start to shift and we start to see symptoms occurring. And so what happens in the vagina is that estrogen actually supports the production of an ingredient, I guess, in the mucus layer called glycogen. And what the glycogen does is it helps support that mucus layer to be nice and healthy, and that then supports the beneficial bacteria in the vaginal microbiome. So
Nice.
yeah, so many people might have heard of the gut microbiome. Well, our vagina has a microbiome as well, and there's one dominant species there called lactobacilli. But and so what estrogen does is it provides the main food source in the mucus for that. So in perimenopause, our estrogen levels are kind of going a little bit all over the place, but certainly as they start to decline, we start to see that mucus layer thin, and that impacts the acidity of that environment. It impacts the viscosity in there. So I guess when we think of our vagina, we think of it as a hollow tube, which I guess it is. But when it's in a relaxed state, it actually sits flat. So when we're not aroused or it's not being used in any way, then the vagina actually sits flat. So when there's less mucus, the walls of the vagina actually rub against each other, and that can cause irritation. And that can be quite painful. And so that's kind of then leads to further symptoms.
Yeah. And so in terms of testing, I know you can test the pH, for example, of the vagina, and there's vaginal microbiome testing. Can you talk a little bit about each of those?
Yeah. So pH testing, I think, is it's a really easy way of keeping in touch with what's going on in the microbiome. So through perimenopause, because of those changes in the mucus layer, we do see the pH move from a more acidic pH of between 3.5 and 4.5 and move sort of up to the higher end, up to, above 4.5, which is less than ideal, I guess. And the vaginal pH test strip kits that you can get them online, you can get them at some chemists. That's a really good way of being able to check in and see what's going on in the vagina, because often what we see is that presentation of symptoms follows a rise in that vaginal pH. So that's actually, for someone that gets symptoms regularly, that's actually a really nice way of kind of being able to check and see what's going on a more regular basis. The vaginal test kit, so there's quite a few different options around, both here in Australia and from overseas. And what they're doing is often they are checking the pH, but they're going into a lot more detail. So they're actually looking at the flora that makes up that vaginal microbiome. So they're looking for the lactobacilli, what type of lactobacilli. They're looking for Candida species. They're looking for other opportunistic bacteria. So if there are symptoms occurring, so whether that's itching or dryness or discharge or smell or whatever, discomfort or whatever it might be, we can test that and we can see what's going on more specifically so we can be a lot more targeted in the treatment while we're addressing the root cause of why that's happened in the first place.
Yeah, it's so good to have these tools available to us, but generally you're probably not going to get recommended to do that by the GP. I think it's more the naturopathic profession that's kind of leading the way in this aspect. I mean, unfortunately, they are things that you have to pay for. There's no Medicare coverage for any of that kind of testing, but it can make a big difference to have the knowledge of exactly what you need to manipulate, I guess, in the microbiome.
Yeah.
Rather than just taking a bit of a guess.
Yes, absolutely.
Right?
Yeah, that's absolutely right. Yeah. I mean, the more information, knowledge is power. So the more information we have, the better results that everyone's going to get.
Yeah, exactly. You're not going to waste, I guess, time and money throwing things at it that maybe aren't going to be as targeted and not going to get you that faster result. And when you're talking about vaginal health, I mean, it's very uncomfortable to be having those sorts of irritated symptoms.
Yeah.
I can imagine it'd be very distracting, probably a lot of the time if you're at your workplace or, you're trying to enjoy life and you've got these distracting symptoms. If you can get on top of it as quickly as possible, it really improves quality of life, I can imagine, quite substantially.
Definitely. Yes, definitely. And I think for many women that put up with those symptoms for such a long time, we don't want to muck around. We want to get on top of it. Yeah.
Exactly. So, we've got these symptoms, we've got the testing. So what then treatment options are available specifically for this, menopausal or perimenopausal dry vagina?
Yeah, there's a couple of things that I use quite regularly. Sea buckthorn is something that I use a lot of in this age group. I think it's a beautiful way of really being able to support yourself. And what I really like about it is alongside other herbal interventions to look at what's going on with, supporting hormone balance and things like that. Sea buckthorn oil is something that often my clients will use, daily for a couple of months, and then we'll start tapering it back.
Yeah,
and for
that's
some of
applied into the area, right? It's not.
You can take it orally.
So it
depends on the level of inflammation that's going on. So sometimes I'll use fennel oil, like in a cream or something like that, topically. Sometimes we'll use the sea buckthorn oil topically and orally. So we might go, okay, well, let's do your whatever dose and do 5 drops and wipe that over the vagina with a clean hand and take the rest orally or whatever it might be that suits that particular person and that presentation, because that can make a really big difference to the itching and dryness. And I find that working internally while alongside of hormone balancing is just, it's a beautiful combination that's really settling. I've also had a few clients make up their own flaxseed gel. So I've got a recipe that I give to my clients. Yeah, it's beautiful actually. It can be used topically to kind of soothe irritation and itching, but it can also be used as a lubricant. It can also be used as a hair gel, but most of my clients don't use it for that. It's more the lubricant and the soothing aspect of it that we're looking for. But it's a really nice thing that they can make up themselves at home, use as they need it.
Yeah.
And obviously, from a diet and lifestyle perspective, we want to look at what's going on hygiene-wise in that area as well. We want to avoid anything that's going to irritate the vagina. So we don't want any, vaginal sprays or harsh soaps or, even things like looking at what type of underwear people are wearing, or are they, going to the gym and getting really sweaty but not changing their clothes for a really long time. All of those sorts of little bits and pieces make a really big difference to how that area of the body is actually feeling.
Yeah, and it's true, isn't it? Like with the rise of activewear as an all-day kind of attire. And yes, I can imagine many women are going to the gym, maybe particularly here in Queensland where it is very hot. So,
Mm,
even if you get changed and have a shower, if you're throwing activewear back on and it's, they're generally not made of natural fibers, and you're sweating during the day, it's not really well, actually, it is an ideal environment for not so good bacteria to thrive,
yeah.
and fungus and all of that sort of thing. But yeah, I can
Yeah.
imagine that's not ideal. And it's maybe not something people are really thinking about.
I think there is often some little changes that people can make, like including flax seeds in their diet, like wearing cotton
Mm,
underwear, like, using water to clean their vagina rather than any, special perfumes or whatever,
mm.
or soaps. And those little changes can make a really big difference.
Do you find that many women are using, different sort of, I'll call it chemicals because that's generally what they
Yeah.
are, in that area with a view to deodorizing or the hygiene, that kind of thing? Are you finding that there's certainly, I know, we're probably a similar vintage. As a teen and in my 20s, those products didn't exist.
No, I know.
It didn't
Yeah.
exist. It's not even a thought that that
Yep.
was a necessary kind of product.
Yeah.
So, are you finding that women are tending to use that, or maybe it's more of the in their 30s now that are probably going to come into perimenopause in the next 10 years that might be using them more? What are you finding?
I think it's both. I think what I find is that women with vaginal dryness don't necessarily recognize it as dryness. They recognize it as itching and
Mm,
irritation, and therefore there's a lot of confusion over what is
yeah.
actually driving those symptoms.
Yes.
And therefore they're using, they might be using thrush treatments, or they might be using, a body spray, or a vaginal cream that's, just from the chemist, that's full of fragrances and
Yeah.
all sorts of things that is actually disrupting the natural flora that's going on there. And while some of them might provide a little bit of short-term relief, they're actually making the problem worse in the longer
Mm,
term.
yeah, yeah. Because I guess too, in fairness, like we probably didn't even know that the vaginal microbiome existed when
No,
those products first came out. So yeah, and I think probably a lot of women still don't know that we have a separate microbiome down
no.
there that needs to be looked after so that
Yeah,
you're getting kind of the best health possible
yeah,
for your vagina and for that longer term health as well.
yeah, yeah,
Um,
definitely.
yeah. So, we've talked about treatment options. What about, how can women advocate for themselves when they're seeking help for vaginal symptoms?
Yeah, I think this is a really big one for me, and it comes back to some of the things that we were talking about, at the start of this conversation
Yeah.
about, you know, if your GP or your healthcare practitioner has never asked about vaginal health, then that can make it really, really difficult for women to feel comfortable in approaching that conversation.
Mm,
So I think advocating for yourself is really about being confident that you are the expert on what's going on in your body, and that if a medical practitioner, no matter what type of practitioner they are, if they dismiss those symptoms without testing, without investigating, without asking questions, then it's time to have a look at it for another practitioner,
mm,
because we
mm.
do need to take this seriously, as seriously as we take a broken arm, or whatever else might be
Yeah.
a complaint, or a symptom that's happening on the body. Is so many instances I hear of women going to a healthcare professional and being thrown some cream with no no testing, no
Yeah.
questions kind of asked, no detail being looked into. And of course, that's not going to work. So it's
Yeah.
really about saying, this is impacting me. This is impacting me in these ways. I need this taken seriously.
Mm,
And
absolutely.
having the confidence in them that they know their own body better than anyone else.
Yeah.
And really, yeah, that self-care aspect is really about being confident to say, I know what I'm talking about here.
Yeah. And, in defense of GPs, we know, and they seem to be more openly talking about the fact that in terms of menopause and perimenopause, in their entire training, they probably have 1 hour of
Oh,
training.
it's crazy. Yeah.
So
And I
often
do
they
see a
don't know
shift
what to
there.
do.
Yeah,
Yeah.
that's right. That's right. I mean, I have a female GP myself, and
Yes.
so um she has asked about vaginal health in the past, and so that opens up that conversation. But I've all equally spoken to clients who haven't had that, been fortunate
Yeah.
enough to have that experience. So it really is about finding the right practitioner.
It is. And also, I guess, booking the right appointment length, because I think that's
Yes.
another thing in terms of how the GP works with their patients is they have a very limited
Yeah.
time. And I'm very excited. As we're recording this podcast this week, the government has announced some very exciting changes in the way
Yes.
menopause care is being funded, and that there
Yeah.
will be funding for longer consults for menopause discussions, which is great. I mean, obviously, you need to find a GP that has menopause training
Yeah.
in order to actually get a solution. But and also saying that, you're not necessarily going to get microbiome testing or pH testing
Yeah.
from the GP because they may not just have that training.
Yeah.
So sometimes you need to have both type of practitioner, to
Yeah.
the natural health practitioner that has that training,
Yeah.
as well as the medical practitioner, so that you can
Yeah.
get kind of both sides of the the support that may
Yeah.
be needed for that kind of health. Because
Yeah.
obviously naturopaths don't do physical examinations
That's right.
of that area. So,
Yeah.
there are we don't do pap smears, we don't do all of that sort of stuff. So you do definitely need to have a practitioner that can do that aspect. But
Yeah.
yeah, that's not, so yeah, having both, I think if you've got find the right one, and
Oh, it
it
makes the world a difference. And that's why
yeah.
I really love what we do, is because we
Yes.
work hand in hand with whatever team that
Yes.
the person sitting in front of us puts together. We can work within that
Yes.
scope. There's so much. I have clients who are on, HRT, or,
Yes.
doing all sorts of pharmaceutical treatments, and we can work really well alongside that.
Yes.
Equally, if someone doesn't want to go down that path and wants to try herbal support first, then absolutely we can do that. It's about working in the context of what's right for that person. And
Yes.
there's no one answer to that. Yeah, no matter what we're doing, there's always room to work side by side
Mm.
with
Mm.
GPs and gynecologists and, whoever else is on that person's medical team, for sure.
Yeah. Yeah. Awesome. Yeah. And that's what I like to make really clear, because I think sometimes as natural health practitioners, we can come across as being anti-conventional medicine, but
Mm-mm.
generally speaking, that is not the case.
Yeah,
And as you so beautifully said, Alison, we can work hand in hand with whatever team the client or the patient would like to have on their team, because
yeah,
the more, I guess, informed and educated practitioners you have available to you, hopefully you'll get the ultimate outcome, which is optimal health.
yeah.
So I wanted to change tack a little bit, and let's talk about thrush, because thrush is, I think, something that people are more aware of. I think they potentially are more comfortable discussing it, because it does seem to be something that's just so common, and
Mm,
many women have it at all stages of their life. So, if they've been having episodes of thrush since their 20s, generally they're very, very comfortable going down
mm,
to the pharmacy and asking the pharmacist for treatment, or talking to their doctor. I feel like that's probably, for whatever reason, has a bit less stigma attached. I don't know if
yeah,
that's your experience, but it seems to
yeah,
be mine.
yeah,
So if we can talk about recurrent thrush, which does start to occur in this age group of peri and postmenopause,
yeah,
can we talk about, the importance of testing, for example, to get the right treatment,
yeah,
rather than just fronting up to a pharmacy and
yeah.
getting what they give you? Can we talk about
Yes.
that?
Yes.
I
It
can
is a bit
see
of a
the
bugbear
bugbear for
fight.
you.
Yes.
Yes. All
Yeah,
right,
this is
let's do
something that
this.
I'm like, yes, let's get into this. Yeah, because I do see it time and time again where people have gone, I've got itching, I've got a bit of discharge, I've got a bit of discomfort, I'll just go to the chemist. Okay, that seems to have settled down, not completely, but we're okay now. a month later or a few weeks later, it happens again. They go back to their chemist. If they're going to the same chemist, the chemist might go, no, actually, you might need to go and see your GP. The
Mm.
GP might just still give them that same treatment, or a really good GP will actually swab. That doesn't always happen, but when it does, it's
Yeah.
gold
Yeah.
because thrush isn't always thrush.
Yeah.
So when there are recurrent symptoms that are not being treated, that are not going away, then we need to look deeper. We need to look at what's actually going on there, because there are so many other issues that can occur in
Mm.
the vagina that present really, really similar to thrush that are not actually thrush. And so those over-the-counter treatments for thrush are just not going to cut it.
Mm.
Even eczema, you can get eczema in the vagina. I've got
Mm.
one client who we've really been able to sort that out. So as long as they don't eat a particular food, they
Yeah.
don't get any symptoms, but as soon as they do, they get a flare up of eczema, not
Oh,
thrush.
that's
But the
awful.
only way you can tell that was by swabbing and,
Yes.
yeah, anyway, going through all of that.
Mm. Mm.
Bacterial vaginosis can present really in a really similar way. Cytolytic vaginitis can present in a really similar way. Like there's a whole list of things that are really, really similar to thrush in that
Mm.
itching and irritation and um, painful urination and discharge. But with without testing, you don't actually know. So the GP can absolutely swab, and a lot of them do, not always, but a lot of them do. Um, and that can tell you because the other thing is different types of candida can be present, and
Mm.
some different types of candida actually need a different type of treatment.
Well, there you go.
So you want to make sure that we know what's there to know what we're treating.
Yeah. And I guess that's what we're talking about. How can women advocate for themselves is actually knowing to ask, could you please swab?
Yes,
Because this has happened a few times now. And what
that's
I'm
right.
doing clearly is not working well
Yeah,
enough.
yeah, that's exactly
So
right.
that's the fact that women actually have that knowledge to
Yes.
know that maybe I just need to nudge the GP a little bit to get that testing done, because maybe that's not in their mind, and particularly if it's, an 8-minute consult and they're just
Oh,
trying
I know.
to,
Yeah.
get through and trying to find something to help you, which generally is just going to be like a
Write a
cream or whatever.
prescription.
Yeah,
Yeah.
write a prescription that, yeah, let's actually do a swab and really get some good information.
Yeah.
So how do hormones impact thrush-like symptoms?
So very similar to what I was talking about before. So if estrogen is too high or too low, we see the changes in the mucus, and that then changes the acidity, which changes the environment. Now,
Mm.
once we get to an acidity level that's too high, so too alkaline, then microbes like Candida, which is what causes thrush, microbes like Candida, which are naturally occurring on the surface of the skin, then we just get more of them, and it gets too
Mm.
many. And that's when you start to get the symptoms occur.
Mm.
And so what the creams are designed to do is they're antifungal. So they're designed to kill off the excess fungus or the excess candida to be able to bring everything back down to normal. But all they're doing is treating that one event. They're not looking at what's going on underlying that. So we want to make sure that those hormones are actually in really nice balance
Mm.
as well, so that we
Mm.
don't get this recurrence. And that's why thrush can be quite cyclical. So some women will get thrush like at ovulation and just before their period when our estrogen levels are really low. And other women will get thrush just before ovulation and sort of about a week before their period, which can be an indication that estrogen levels are actually spiking too high. And that's actually changing the vaginal flora and the vaginal pH. So that's
Mm.
where, we're talking about pH testing. Actually, testing your pH levels can tell you whether or not those symptoms are likely to start happening again.
Amazing. That is amazing. And in terms of the vaginal microbiome influencing the symptoms, can you talk a little to that?
Yeah,
Mhm.
so when the lactobacilli are not in enough quantity to be able to keep the candida levels under control, that's when we start to see that happening. And then, of course, we need to make sure that it is actually candida, because as those lactobacilli levels drop, it actually predisposes the vagina to all sorts of other pathogens as well. So that's when you start to get the discharge and the itching and the smell and the irritation, depending on what's actually ends up growing in that environment. That can influence, the type of discharge or the type of smell or whatever it might be, whatever those symptoms might be. So yeah, and there can be really similar presentations with completely different causes.
Yeah, yeah. So interesting. So what are some of these other things that can cause symptoms that are similar, and what can women do to prevent thrush occurring or recurring, I should say?
Yeah, so a couple of the things to do to prevent thrush recurring. So we want to cotton underwear is probably the number one, cotton or bamboo underwear, and going commando. So they're two of the things that I often have my clients doing. And for someone that has experienced recurrent thrush or, other recurrent issues, some of them I'll get them to actually change their underwear, buy new underwear every 12 months because we want to prevent any buildup of bacteria in the underwear. Line drying clothes, so washing clothes thoroughly and then drying them in the sun can actually make a really big difference, allowing the vagina to breathe. And things like that we were talking about earlier, so not using like vaginal sanitation, I guess, products. The other thing is that if someone's getting thrush, I forgot to mention this before, if someone's getting thrush and they're using reusable menstrual products.
Oh, yes.
So like period undies or menstrual cups or menstrual discs, and they're finding that the thrush symptoms are occurring towards the end of their period, they need to sterilize and change those menstrual products more often. So a lot of those reusable menstrual products are designed to kind of go all day without having to change it. But that actually changes the pH or the acidity of the vaginal microbiome, and that can itself lead to symptoms. So most products, if you go to the website, there'll be a sanitation process or a deep clean for period undies, or for menstrual cups and menstrual discs, it's pretty easy. Wash it in a mild soap and then boil it for a minute or some, for 30 seconds or something. And that will sterilize that. And changing more often. So if you're using a menstrual cup or a menstrual disc, change it every 3 or 4 hours rather than going for sort of 12 hours. Makes a really big difference to that as well.
Yeah. Yeah, amazing. Such good advice. And Alison, I also wanted to talk about bacterial vaginosis, but I think we might come back and do another podcast because
that is worth a whole podcast.
I know. That's what I'm thinking. That's what I'm thinking. And there's been so much amazing information from today. And I think I'd like to get listeners to absorb that, maybe even listen to this again, because a lot of these concepts are going to be new.
Yeah.
And I think I definitely want to get you back to talk about bacterial vaginosis, or BV as we like to call it, because that's something that I'm hearing a lot more of. I'm getting a lot more clients that have it. And I think women just need to know more about it.
Yeah, I think so too. Yeah.
Awesome. All right. So, Alison, where can people find you online if they'd like to get in contact with you?
Yeah. So if they look up the Vag Hormone Naturopath, it's very long, I know. But so the vaghormonenaturopath.com.au is my website, or on Insta or Facebook, the Vag Hormone Naturopath with dots in between each word. And that's probably the best way to find me. From there, you can find out more about me, contact me, book an appointment, whatever suits.
Amazing. And I know we were talking before we started recording about a little ebook that you have that's not published, so not just anyone can get it. Can you talk a little bit about that?
That's right. As of this moment, it is an exclusive for your listeners because I haven't put it anywhere else yet. But yes, I do have an ebook on why over-the-counter thrush treatments might not be working. So if someone would like a copy of that ebook, DM me, send me an email, hello@thevagihormonenaturopath.com.au, and I'm more than happy to send out a copy of that.
Yeah, and that's free of charge, right?
Yes, absolutely it is.
Awesome. Awesome. All right. Well, Alison, it has been like such a great podcast ep today. I've been so excited to get all of this information out to my listeners. I really appreciate your time. So thank you so much for being here.
You're more than welcome. Thanks, Susie.
Thanks so much for joining me today on the Ageless and Awesome podcast. If you liked today's episode, I would love it if you could write me a 5-star review. It makes me so happy. Also, make sure you click the little plus button if you're on Apple Podcasts or the follow button if you're on Spotify so that you can get each new episode delivered to you every week. If you like free stuff, then head to the show notes and click the link to receive my free Radiant Reset Hormone Detox Guide for perimenopausal women. Now, this will only be available until the end of January 2025, so be quick. If you'd like to continue the discussion we've had today, head over to Instagram and DM me or follow me at the Perimenopause Path. And there's a little dot between each word, just to make it a little bit more complicated, but I would love to connect with you over there.